I'm Dr. Will Kalla, chiropractor at Precision Spine. It is a chiropractic clinic on Orchard Road in Singapore. Here is an X-ray of a normal neck. It has 7 bones. At the top one we have atlas, then C2, C3, C4, C5, C6, C7. And it forms a nice arch like this. And it goes forward, and that is called the cervical lordosis. When you measure from the 2nd vertebra, the posterior tangent, to the 7th vertebra here, a normal arch should be at 34 to 42 degrees. Our neck is very flexible, so when you view the neck from the side and is bending all the way forward and all the way backwards, the total range of motion is 130 degrees. When you tilt your head side to side, the total range of bending is 45 degrees. And when you turn your head, rotating your head to each side, your total rotation is 80 degrees to one side. Because of the neck's high degree of mobility, it is easy for the neck to lose its normal curve due to repeated poor posture and ergonomics. Think, for example, when you use your mobile phone or laptop. You'll be hunching over and looking down on the screen. Doing this repeatedly and for hours daily, your neck slowly loses its curve and adapts to a new alignment. The new poor alignment can be a straight military neck, complete lack of curvature, or forwarded posture with maintained lordosis, or forwarded posture with a kyphotic neck, or reverse curvature of the neck, kyphotic neck, or an S-shaped curve of the neck with double curves. All these have one thing in common: extra pressure and strain in your neck for the disc and bones, causing disc degeneration and bone spurs, and also affecting your muscles. The result is, first, you have stiff and tight neck muscles, and later pain follows. The only long-term solution is to correct your neck back to its original alignment, the normal cervical lordosis. Restoring normal cervical lordosis removes the extra stress and strain in your neck and can halt the slow spine decay. If you don't, the degeneration will keep getting worse and worse, and you will have chronic pain for years. Then 2 things usually happen. You either end up with fusion surgery or the bones fuse themselves. The grim outcome can be prevented in many cases by correcting your neck. And in many cases, that can be done in a few months. This is where I can help you. Every day at work for over a decade now, I have been correcting spines, and I have gotten rather good at it, at fixing necks back to normal alignment. And by fixing your neck, the most symptoms fade away, be it neck pain, tension headaches, upper back pain, shoulder pain, pain or numbness down the arm or down to the fingers. I want to show you how I can help correct your neck. Most neck problems have been around for years, and you may have developed very stiff and tight neck muscles. We have a solution for that: percussion massage. This has become very popular in the last few years. Well, we have been using this machine since 2007. The problem with battery-driven devices is that they run too fast. As a result, the effect becomes very localized and doesn't penetrate deep and spread far enough. We use percussion massage to loosen up the upper back, shoulder, and lower neck area. A few minutes of this does wonders for our clients. Even the most stubborn, stiff necks do loosen up in a few sessions. Patients love this. Next, we have our seated traction. Again, we use 2 pulling forces that are adjustable according to your needs. Therefore, we can direct how your neck is being tractioned to best help restore it back to normal cervical lordosis, giving you long-term relief. What is different between our approach versus the traditional traction? The conventional method used in hospitals or by other physiotherapists or chiropractors is that they just use straight traction to elongate your neck and relieve pressure. This does relieve stress and can provide temporary symptom relief, but usually comes back after a few months, as they did nothing to fix the underlying problem. Vibration traction helps to loosen up even the most stubborn necks effectively. Again, here your neck is held in slight extension to promote normal neck curve to take shape. Here's an analogy for how the vibration traction works. Think what an earthquake does to a brick house. It doesn't break the bricks, but helps to separate the bricks from each other. Not the most perfect metaphor, but you get the idea. We want to loosen up the connective tissue in your neck to allow normal lordosis to form and let the bones go back to their normal, correct position. The next is spinal adjustment. It's me manipulating your spine by hand or with the help of an instrument to benefit joint stimulation. Most clients like to be adjusted, but I don't think there's anything magical about our technique. I am sure it's very similar to what many other clinics are doing. There are studies to show that spinal manipulation alone does not correct your neck. And lastly, we have neuromuscular reactivation. Again, it is a postural exercise to help you retrain your neck and reprogram your brain to what is normal posture and neck alignment. Usually, we can help in 2 months to achieve a normal neck for you. If you want to enjoy long-term relief, contact us on the information on the screen.